even though I do prefer to walk around, but let's do it this way. Thank you very much for your introduction, and thank you very much, ladies and gentlemen, for giving me the opportunity to give you a picture of how we work with welfare technology in my country. But first, let's just have a short picture of what we are in Denmark. We have a tax-financed universal welfare service system. We are 5.5 million inhabitants. We have 3 levels of government, 3-tier system, with state who lays out the framework from the work in the regions and the municipalities. We have 5 regions. They are responsible for health, hospitals, general practitioners, and we have 98 municipalities who are actually responsible for the rest of the public service sector. The public service sector in Denmark is financed by the taxers, so it's free of charge to use education systems, hospitals, universities, and social welfare services. You don't pay for it because it's tax financed. Most of those suppliers are public suppliers, but we have also private suppliers, of course, and they are financed by the tax system. The total cost that we use for welfare consists of about 29% of gross domestic product. And that's quite a lot, I would say. 29% of the yearly value of the production in my country is used as public financed social welfare supplier. And then we have a thing, I think you should notice it. We have a unique data opportunity in the CPR number system. Newborns get unique ID numbers that follow them over life. I don't know if you have this in your country. You have it? So you are in the same situation we are, because it does make it a little bit easier to work with IT solutions and ICT solutions. And now, when I talk about welfare technology, I include IT solutions as well as ICT solutions, information communication technologies, as e-health technology, for example, if it is user-oriented. These technologies that are user-oriented, we call them welfare technologies in my country. Now, I will give you a picture of why we work with this kind of technology. I will tell you how we do it, and I will show some examples so you can see what I'm talking about. And I just have to push the right button. But for you to understand, when we talk about digital welfare, I have to go a little bit back in history. We go back to 2007. In 2007, we had these challenges in front of us. You have, I think, the same demographic challenge. We have an aging population that will accelerate demand for care and treatment. We know that. But we also had what we call recruitment challenges, because a large part of those working in the social welfare sector and healthcare sector are leaving for pension in the next years. So we might have recruitment problems. They are not that big as we thought that they would be in 2007 because of the financial crisis, but we still have recruitment problems. So the government settled down a commission, and the chairman of the commission was actually the Prime Minister in Denmark, so we had to work very hard in that commission, of course, when the Prime Minister is chairman. And the problem we tried to solve was, how can we develop our welfare sector when we have these challenges in front of us and we don't want to expand the budgets? How is that possible? So we said we had to rethink the way our society delivers care and treatment. That was one thing we said. And then we'd never heard about welfare technology. That was not a concept we used. It was known in 2007 and 2008. But we have heard about a health insurance company in California, Kaiser Permanente is called. And in California, Kaiser Permanente works very hard, very much with welfare technology, e-health solutions, IT and ICT solutions. And we could see that they actually strengthened the economy by using this kind of solutions, and it gave a rise in quality for the users. So we said, we want to have intensive use of technology that can strengthen the economy and cope with the challenges you have here. And I put the right button again. Yes. And then we said we must promote innovation in the public sector. We must persuade the public institutions, hospitals to work with new technology. They must be interested in what we call innovation. And you can't expect innovation to come from private companies. The innovation in the public sector must come from inside the public sector. And that is quite another way to manage the systems in the institutions and the hospitals than we were used to. So we made some changes here as well, which I will talk about later. I will talk about two main initiatives we took many initiatives, but these two have something to do with welfare technology. We made the government strategy, the digital route to future welfare, that I will talk a little bit about. And then we had a program for promoting demand-driven innovation. And the last program is focusing on what we call welfare technology. And let's have a look at that. First, the digital route to future welfare, 2011 to 2015. Here we say we don't want printed letters between citizens and municipalities and companies and municipalities. And when we come to 2015, 80% of communication between citizens and municipalities and companies will be digital. Only 80%, we don't take 100% because there will always be a part of the citizens who can't work with digital communication. 80% of all communication will be digital. Then we say we want to work with new digital welfare, and this is what I'm going to talk about a little bit later, so we will return to that. And then we say we want closer digital collaboration in the public sector. We want common infrastructure between state, between regions, and between municipalities. Otherwise, we can't use technology. And I will explain why in a few minutes. We want to share core data. If one authority has the data, we don't need to create that data again. You can transfer the data between authorities. We want to look at the legislation. Why do we do that? Because the legislation we have was produced in the time when we worked with analog solutions. Now we are talking about a system with digital solutions. So we have to go through our legislation to see if there are any barriers to use digital solutions. And then we are looking at the management of institutions in the public sector as well as in hospitals and social institutions and schools. They must be oriented and focused on digital solutions and on welfare solutions, welfare technology solutions. They must work with what we call business intelligence and what we call IT governance. They must integrate IT solutions in their governance. That is a demand they give them. Otherwise, we won't succeed. They have to think with digital thinking. They have to manage digital. And they didn't do that in 2007, 2008, I would say. Now, just to show you what we're talking about, let's take the healthcare sector. Here, the e-government strategy says we want fully digital clinical workplaces at hospitals. We want electronic healthcare records in all regions and hospitals. And we have that in 2013. In 2000, this year, all hospitals will have electronic healthcare records. What is this? Why do we do that? If you have that, then the professionals do not need time to log on to many other different systems looking for print journals or searching for information from various scenes. They have it all in the electronic healthcare records. There are x-rays, there are test results, there are information about medical consumptions for the citizens, and results from previous examinations. This is one big condition we say that must be fulfilled for us to work with welfare technology. We have the same in the municipalities. They have electronic care records. All municipalities will have that in 2013. Then we want, of course, to have secure and cohesive communication that is very important to know for the citizens, that we're talking about secure communications. It's only those who can use the information and has to have the information aggregated, other people can't get it, because this is personal information about my health situation. And then we said we would make an action plan for rolling out telemedicine. I'll talk about that in a few minutes. So let's go to the next slide. Demand-driven innovation, that was the other initiative. So we wanted to use welfare technology in the public sector. Danish regions were not so much interested in it, and the local government in Denmark, who represents all municipalities, they were not interested. But we were interested, because we thought this is the way out of the problems we have and the challenges we have. So what did we do? Yes, the government allocated 400 million euro, 400 million euros, that's quite a lot, to support welfare solutions, welfare technology solutions in municipalities and in hospitals. And we paid 75% of all the costs, of all expenses for the project we decided to support. It was a bottom-up approach. We asked communities and we asked hospitals to give us some applications. And if it was good applications, we would support them. The aim of this was that the government wanted to make risk-based funds viable in order to get good business cases. And projects with good business cases can then be implemented at a national level. So we supported up to about 70 projects from 2009 to 2012. And we had some preconditions for us to support a project. It must be about innovation, which means it must be a solution that works with new technology or new ways of using existing technology. It should have, we said, a potential for a positive business case concerning productivity and service improvements. So the employees, with some work intensity, could produce more service to the citizens. That was one of the targets. A potential for a positive business case. And then we said it must be a solution that can be mainstreamed, proliferated, if it turns out to produce a positive business case. If it turns out to give more quality for the users and a more efficient use of the resources. Then we wanted to be able to disseminate in the whole country. And why do we do that this way? In Europe and EU, we have hundreds of good solutions that never became a mainstream part of supply. It's just pilots and pilots and pilots. And they have very good results, but they are never going to become mainstream. We have pockets of excellence that don't spread. We wanted to spread the good solutions. Otherwise, we couldn't cope with the challenges that we saw in front of us. We also learned by experience what was difficult working with this. The good solutions you get if the public actor uncover problems and challenges, says these are the problems I have in the work we have here, and then you invite private companies to come with good advices and solve and find solutions. But it's risky. For the public actor, this is very risky because we're talking about innovation. We're talking about things we never did before. And they have limited budgets, so they might not be so interested. Return of investment, how many years does it take until you have paid back the investment? It takes usually 2 to 3 years, and that is a problem if you have limited resources in front of you. And then nearly all the solutions we have seen have impact across sectors. If the hospital make an e-health solution between hospital and citizens, it has consequences for the way you work in the communities. Because in the communities you have home helpers and home nurses. And they have to find another way if you use e-health solutions from the hospital to the citizens. That is a problem, and the private actor, he has no guarantee for success. It might be a failure, because it is about innovation. So it is risky. But on the other hand, if it succeeds, you will have a public-based business case which can be used internationally if they want to sell their products to other countries. And some of them are actually using our business cases to get the market, to get on the international market. And when we're talking about proliferation, when we are talking about dissemination of good solutions, then it's very difficult. You meet this from the management in institutions and hospitals. This is not the vegetarian mentality. They are fearing of doing things different. If you work with new technology, if you work with IT and RCT solutions, you have to change your organization. You have to work quite another way than you used to. It can be dangerous in institutions. They don't like it. There might be cultural resistance. We had many in 2007, 8, 9 people who we would call yes spotter. We had yes spots in the management. What is a yes spotter? A yes spotter who could say, well, I know about the other hospitals where they have very good solutions and they work more effective. But you see, in my world, my hospital world, it's a bit different. We have to develop our own solutions. We can't take what is best from other places. This is a yes spotter, and we have many of them. We needed what we call why nots. What would a why not management say? A why not management would say, well, I think we're saying here, the thing they're doing with the other hospital, which is more effective, it's been difficult, I know that. But why not try to do it? And then, if you have that inside you, then you can implement good solutions. But in 2000, there were not so many why nots. There were nearly yes buts all in the management. It is not like that anymore, and I will explain later why it is not like that. So it's very difficult, it was very difficult for us to implement good solutions. Now, if you want to persuade others to take the good solutions, you must have a very strong evaluation. You have to compare impact of the welfare technology used against current practice. How do we do it with the new technology compared to what we did before? This is a precondition to mainstream good solutions. And we have, in all the projects we have supported, and the way we work today, we demand a business case for the solution. A business case where we can see efficiency gains, where we can see quality gains for the end users and for the employees, where we can see the acceptability of the solution, where we can see the costs of the solution, and then we can see return of investment. How many years does it take until the investment in the new technology is paid off, and you afterwards have released resources that you can use to improve your production, your social welfare, your welfare system, without increasing the budget, because you use the gain to get from working more efficiently. And return of investment, it will usually take, as I mentioned before, 2 or 3 years before you have paid off the investment in new technology. Let's see, I'll show you some cases right now, and then I will return again to what we're doing today. As we can see it, and learned by experience, e-health solutions, the preconditions for working with telemedicine or e-health solution is you must have electronic healthcare records in hospitals, you must have electronic care records, as I mentioned before, in municipalities, you must have safe infrastructure with secure networks, and you must have IT connections between hospitals, municipalities, and general practitioners. And we have that now in Denmark, and the general practitioners in Denmark, they are working digital, nearly all of them. Nearly all of them. We have 2 general practitioners who do not work with digital solutions. All the others are working with digital solutions. So we have networks between hospitals, municipalities, general practitioners, and the citizens. And that is a precondition for us to work with e-health solutions, as we see it. And now I will show you a few of them. Here we have one. It's about diabetes, ulcers, telemedical treatment of ulcers. It's written food and leg ulcers, but it's all kinds of ulcers. Ulcers, when you have diabetic, can develop rather dramatically and result in amputation. Now, what do we do here? The home nurse are visiting the citizen in the citizen's own home. And with her telephone, her mobile, she sends a digital photo from the home to the hospital. If the home nurse thinks that this ulcer has developed back since it was the last time, she will be guided from a specialist at the hospital, because they can see pictures of the ulcer and they have electric care journal, so we can see the situation from day to day, or from week to week, and they will guide the home nurse on the citizen's own home and tell her what she shall do with the ulcer. This project have we been working with for about a few years, and it has turned out to have a very positive business case. So now we have agreed with all municipalities and all regions that this is going to be implemented in Denmark by in 2015. All hospitals, all municipalities will have the solution in 2015. To the advantage of about 28,000 citizens. That will have much better treatment, better quality, and we will use fewer resources in this area. The quality was improving radically with this project. So this was one example of an e-health solution that we're going to implement in the country. This is another example. This is a great scale solution. This is not finished as a demonstration product. It includes, we have 2,000 patients in this product. We have 4 hospitals, 10 municipalities, and we have some general practitioners. Caretakers, nurses are working in the municipality sector, doctors, nurses in the hospital, regional sector, and general practitioners are actually private, but they are financed by the tax system. So we are going across systems. We are going across to the citizens themselves and involving general practitioners, involving municipalities, and involving hospitals. And this has just been started up actually, and after a few years, about in 2015, we will try to make an evaluation, a business case of this. And I will return to that later, what we then will do with the products. Yes, this is quite another solution just to show you what I'm talking about. This is 24 hours, 7 days a week, monitoring of heart patients with pacemakers. We use intelligent band-aids that you have here. A band-aid that you can go there all day and all night, and it monitors EKG, it monitors heart rhythm, sound, and sound from the lungs. And this biometric data is going directly to the hospital, where we can see, well, the doctors, nurses can see if everything is okay with the patient. The patient can be at their own home, the patient can be at work, the patient can be in Australia, it doesn't matter. The system works all over. And it hasn't finished yet, we're working with it, we are trying to make a business case on it, but I think it will be positive. Then we have quite another thing. This is not a bottom-up project, this is the only top-down project that we have supported. Shared medication records. Now, we want to reduce the number of errors in medications, and there are many errors in medications. We want to reduce hospital admission caused by medication errors. We want to reduce time used for medication, and we want a rise in quality in medication for the citizen. If you look at this chart, you can see there are many actors involved in medication. There are general practitioners, there are hospitals, there are home nurses, you have pharmacists, you have emergency doctors, you have specialist doctors, and all these people are communicating medication to each other. They can prescribe medication to the citizen. And if you know some citizen who is bit old. I have my mother, she's very old, she uses a wide range of medication, and she don't know what she's using it. There's so many different things she has. So you really have errors in medication. What have we done here? We have built up this national service platform. The national service platform links all the users of medication. And if the general practitioner prescribes medication for a citizen, it would immediately go to the electronic healthcare record in the hospital. So if the citizen is going to the hospital, they will immediately know what kind of medicine the citizen is using. And all those actors working with medicine will have immediately can see what kind of medicine the citizens are using. This product we have been working with for about a few years, and it's not finished yet. It is not yet implemented in all communities, all municipalities, and hospitals, but in 2014 we think it will be a success. It will have been implemented all over. This was some of the examples I would show you. Here we have another one. Moving of the elderly and the infirm. This is a demonstrating product that we are now trying to implement in all municipalities because it turned out to have a very positive business case. Now, we have about 25,000 people in Denmark who can't move themselves. They have to be lifted from the bed to the toilet and be lifted from the bed to the meeting table. It takes 2 caretakers to lift them, and after a few years they get terrible pains in their backs. Now, with this system, we can use one caretaker to about 75% of all movements, and they won't get pains in the back. And the users are quite satisfied with this solution. Now, if you take an average municipality in Denmark, which doesn't exist, but nevertheless we have 19 municipalities, if you take an average municipality, they would have to invest about €1 million in this equipment for the citizens who have the kind of problems. They are living in their own home or they are living in nursing homes. They will have an effectiveness gains at about 500,000 euro a year. They invest 1 million. They have a gain of about 500, a little bit less than 500,000 euro. So after 2.5 years, the investment is paid off. And then they have every year 500,000 euros to improve welfare service in the municipality, if they choose this solution. Just to give you a little example on the way we think and how we work. These are hospital emergency systems, coordination systems with interactive monitors, tracking of patients and doctors, and mobile communications with the rest of the hospital, instead of using a whiteboard, telephone calls, and oral messages between the employees in hospitals. And when we started this, we didn't know what welfare technology was. We thought it was about robots, but we have only this solution and another one which is about robots. All the other solutions we work with is ICT solutions, IT solutions, and the kind of welfare technology I showed you before. When we started in 2009, not knowing anything about welfare technology, we said we want to work with labor-saving technology. But now, the concept of welfare technology in the Nordic countries and in many European countries is well known, so now we talk about welfare technology. But it is a labor-saving technology. I will say a few minutes about what I think welfare technology is about. So now, the foundation that I am chairman for, we don't call it the Labor-Saving Technology Foundation, and any longer we call it the Foundation for Welfare Technology. And we do not any longer support bottom-up projects. We are working top-down, which I will show in a few minutes how we do that. But from 2009 to 2012, we had many experiences working with this. And I will show you some of the main experiences. And these experiences we have used now to develop a strategy further, which I will talk about in a few minutes. if you work with welfare technology, IT and RCT, you must have a clear business model. Otherwise, you won't succeed. Otherwise, you'll just get away between your hands. You must document the impact of the new solutions against current practice. You must identify outcomes as efficiency gains, costs, return on investment, quality, and acceptability. Otherwise, you won't succeed. And this is also a precondition to persuade others to use the good solutions that has good business cases. Then you have to work with innovation across the entire value chain. You can't only work with innovation in the regions, because what they do has consequences for the way they work in municipalities. So you have to work all along the chain with state, regions, and municipalities. They are all involved in this. Then we say you have to have common infrastructure, otherwise you can't succeed in this. Common infrastructure and common standards, technical standards, and common platforms. I will talk about that in a few minutes again. Then, and this is very important, when you work with welfare technology, you have to change your organization. You have to change the way you work. Otherwise, you won't succeed. You have to involve and educate the employees. They have to have a feeling of this is a good thing to work with, and they must know how they work with the welfare technology. This is about education and involvement. You have to, of course, involve end users, because end users are those who are going to use the new technology. And then you have to look at the legislation, as I told you about, and coordinate your strategy with other IT strategies, which we also are doing. Now, we have, on behalf of our experience from 2009 to 12, changed the way we're working now. We have the same challenges as I mentioned before, but there's one thing, this. We have very tight budgets in the public sector. We use, as I mentioned, 29% of gross domestic product. Now we have political discussions among the parties in the parliament. Some of them say we want zero growth in the public service sector. Zero growth, no growth at all. You have to take this demographic challenges and this that more people are suffering from chronic diseases within the budget. You have increasing demand, but you have to solve the problems in the budget. We won't give you any more money. Then we have politicians and the government today say we will get a very limited increase, yearly increase in the budget for the public sector. And this limited increase will not solve the demographic challenge, and will not solve the problem that more and more people are suffering from chronic diseases. And they are that, we are that. We have 1.8 million people in Denmark who are suffering from chronic diseases. I don't have two of them, but that's another point. But it is because expected lifetime is increasing in our country and increasing in your country as well. And when you're living longer, you will have more chronic diseases. So we will expand the demand for care and treatment. We know that. But we might not get more resources to solve the problems. So now we are in another situation. See, if you want to implement good solutions, and we want that, we want all hospitals and all municipalities to work with the solutions that give a positive business case, then you must have a very strong political mandate. And we have that. The government platform 2011, when we changed government, the new government actually said the same as the government before. We want to expand digitization and welfare technologies to make the public sector more efficient and modern, and to create economic growth. That is what the government says. Then we have the e-government strategy that I showed you before. And then we have the growth plan 2013 for Denmark, the government plan. Here they say that modernization of the public sector shall release 12 million Danish crowns, which is about 1.6 billion euros, to focus on improvements of the public service sector. We say, you have a budget in the public sector, you won't have a rise in the budget. But if you work more effective, we want to find about 1.6 billion euros in effectiveness that can be used to increase welfare production in Denmark. And many of these 1.6 billion euros we're going to find by using welfare technology, IT and ICT solutions. Because we know from experience from 2009 to 12 that by using welfare technology, we improved efficiency dramatically, and the quality for the users is getting higher. They're getting more flexible, they get empowerment, they get more flexible services, they can self-decide when they have to use the service because it's ICT solutions, IT solutions, and welfare technology. So the quality is improving, and we are producing much more efficient. We know that from experience from our business cases. So now the government says, go and do it. But you know, in my country, we cannot do it alone in the government. You must have a very, very strong political mandate also from the regions who are responsible for hospitals and municipalities who are responsible for actually the rest of the public service. And we have that political mandate. In 2012, the government, regions and municipalities agreed that in the future, in the years ahead, we will have focus on the areas very close to the citizens, focus on healthcare, social service and education. And not only focus, we are going in the core service of these areas. We're going in the center of these areas with our solutions. But what we never have done before, we have worked with IT solutions and administration, but now we are going in the core centers of healthcare, social service and education. And this is why we call this a digital welfare policy. And it was published in September this year by our politicians, and the objectives is this. We have two main objectives. We want to secure more efficient production and also to secure more coherent services for the citizens. Coherence in services we have been talking about as long as I have been working on, and that's for quite many years, but we're very weak. We always have problems when we go from the health sector to the social sector, to the occupational sector, to the education sector. We don't have coherent service. Why can we do it now? Because IT solutions and ICT solutions, they don't care about sector borders between sectors. They don't care. They go just horizontal and vertical through it all. They can directly connect municipalities and hospitals to municipalities, with doctors and with citizens. And they can work horizontal between hospitals and municipalities. So now we can secure coherent service. And that is what we want to do. And this is a great advantage for the citizens. But then there's another thing, another objective. We want to involve the citizens much more active in the social, in the welfare production. Because now, if they use the new technology, it allows for more flexibility, more empowerment, and more quality of life. But they also will have much more responsibility than they have today. Much more responsibility for their own situation. Because we want them to use welfare technology so they can be monitored if they're sick. They can be monitored on the working places, they can be monitored on their own home, or they can be monitored when they're traveling around. And they themselves have to work with the new technology. So they get much more responsibility than they have in the system we know today. And this might be a problem if it wasn't because we know that quality is rising very much when we're using this kind of technologies. And then we have some spin-off effects, of course, better working environment for the employees. This is quite a good thing, I think. And it paves the way for growth and innovation for the private sector. Because when the public sector works more systematically with technology, then the private sector would know which solutions they have to develop, and they will know more about the market than they know today. And then we have made this agreement as well. When a digital solution is documented to be positive, when the welfare is delivered digitally, we say if we get the same service for less means or more service for the same means, then the digital solution shall be the first choice. Then you shall choose a digital solution, because it turns out to be more effective and it gives much better quality. This is an agreement we have made in municipalities and regions, and we have also done it this way. We say that when we take a new solution, which is better, more effective, gives more quality, then we talk about replacement and not supplement to the existing services. And this might be a problem for local politicians because it can be a bit dangerous. Unless we know that the new solution is effective, and unless we know that the new solution is market ready, will function, and gives better quality for the citizens, then we can do it. So we have to document and document and document quality and efficiency in our solutions. Otherwise, we can't replace the new solutions with the thing we did before. This also gives new roles for the employees, actually, as you can see. Now, in my country, we say that employees often do the things for the citizens. For example, elderly people or handicapped people have employees who are doing the job for them. Let's not do that in the future. Let's then work in cooperation with the citizens, so they can teach the citizens to use welfare technology, so they increasingly degree can handle their own situation. This is what we could call a kind of rehabilitation, actually. Now, let's see how we're going to work with this. We cannot implement solutions if we don't know the outcome for the citizens and the outcome for the budget. We have to know that. So, we can have specific knowledge about what is working, and we can set some overall objectives. And we'll give you an example of that. Now, we have an overall objective where we say we want to use digital solutions in rehabilitation and training. But we don't know much about digital solutions in rehabilitation and training. So right now, we know that some of the municipalities are working with these kind of technologies, but they don't know the outcome, as well as we don't know the outcome. So now we are making an analysis of the experiences from the municipalities. And in April 2014, we will have this analysis. And on background of this analysis, we will make a large-scale product of several large-scale products between municipalities and hospitals where they work with new technology. And after 1.5 years, when I've been working, we will make a business case. We will evaluate the large-scale products and see if they work good. And if we get a positive business case about the technology, about productivity and improvement of service, then we will implement it nationally. Then we will make specific objectives and say, by in 2019, we will disseminate this solution in our hospitals and our municipalities. In negotiation with municipalities and hospitals, actually, we have negotiated this solution so we know they will implement it if we get a positive business case. This is some of the way we're working from demonstration, analysis, demonstration project up to large-scale products, and then if we get positive business cases, we will make national initiatives so it will be disseminated in the whole nation. We have, I'm not quite sure I have so much time left. How much time do we have left? A few more minutes. We have 7 focus areas we are looking at our new strategy. Dissemination of telemedicine throughout Denmark. I've shown you that, but I will show you to it again. We want effective collaboration in the health sector. I talked about that before. We want welfare technology in the care and nursing sector, social welfare sector. We want new digital path and case processing, and we are working with that. We want digital learning and education in the education sector. We want digital collaboration in education, and I will show you examples of that in a minute. And then we want to work with the preconditions for digital welfare, the motorway, the platform for our technology. I will not go through all this because then we have to stay here all night as well, but I will just show you a few examples. Let's look at the dissemination of telemedicine throughout Denmark. How do we do this? Now we have formulated an overall objective that says that we want to disseminate telemedicine solution throughout all Denmark. We have one solution that I showed you before. It was treatment of ulcers from diabetics. Here we have a positive business case. We know it's efficient. We know it rises quality for the users. So we have made an agreement with all communities and hospitals, and this solution shall be implemented by in 2015. So all hospitals will have that technology by in 2015. And we have two rather great projects in front of us. I showed you one of them before. It's all about 3,000 patients altogether, or citizens. It's three regions with 5 hospitals altogether and 18 municipalities and general practitioners. This has just started up, started up last year actually, and when we work about 1 year more, then we will make an evaluation. And if this evaluation, the business case says that this is an efficient way of using the technology, and if it rises quality for the end users, we will make an agreement with hospitals and all municipalities that it will be disseminated, and we actually have made that agreement, so we know it will be disseminated in all Denmark by in 2019, if it turns out that it's a business case. But that is, of course, a precondition, otherwise we won't do it. And we have a rather strong feeling that the business case will be very positive. So, but what do we then do? Yeah. When we come to 2015, we will find 1 or 2 other large-scale production products in the vykęs solutions. And when they have been working for about, we do it in municipalities and hospitals and general practitioners and citizens, and then we're working for about 1.5 years. We will evaluate it, and if it turns out to have a positive business case, then we will implement it in all Denmark. And this is the way we will continuously work with these problems. And in this way, we think that we will be able to implement all telemedicine solutions where it's possible to use it in all Denmark. Because it turns out to be very effective and it rises quality for the end users. Now, I'll show you one thing here that we also implemented in all Denmark. It's a very strange project somewhere. It was a hospital who some years ago asked our foundation to support the system with video interpretation. So the interpreters would not go to the hospital, but you could see her on video connection. Now we said we would support this product on one condition, that the infrastructure, that the platform you use, built up for this, can be used by all hospitals. Now it turned out to have a very positive business case. So now we have said and agreed with all the hospitals that this shall be implemented all over Denmark in 2014. Then all hospitals will use this solution. But then we realized that local municipalities can use the platform as well. So now we're testing in these municipalities, and we think there will be a positive business case. So after a year, I think all municipalities will try to implement this solution. But then we realized that this solution could also be used by general practitioners. So now we are trying to test it with general practitioners. And then we saw that this could also be used by the court system. Some of the things you can use by video transmission. So we are testing it in court systems as well, with the same platform, with the same infrastructure that we built up to the original system. And then we know that this system is used as communication between hospitals and municipalities. Just to show you that when you start with a project in welfare technology, you have to think clearly, because perhaps the thing you are supporting can be used in many other ways. And that's an example of how we can do this. And this will be fully implemented by 2014 in all hospitals. This is what we saw before, and another solution. We have made an agreement with all municipalities in Denmark that they shall implement 4 welfare solutions in 2017. One of them is the lifting system, and there are 3 other systems. We have all tested these systems with our foundation. We have positive business cases. So we say that when this has been implemented in all municipalities, they will have at least 0.5 million Danish crowns, which is about 67 million euros. 67 million euros a year to improve their service production for the citizens. 67 million by using 4 different welfare technologies. And then, of course, we will do this next year, in 2014. We will find some new areas where we can work with welfare technology. We will ask some municipalities to work with it. We will make a business case. And if it turns out to be positive, we will implement it with municipalities, non-municipalities. This is the way we are doing it, and as you can hear, without the strong political mandate, we were not able to do this. Then we are talking about education as well. We don't know much about digital learning, I must admit that. What is the best kind of teaching for some pupils, children, young people? What is the quality in education when we use digital learning? And what about use of resources? Actually, we know nothing about it, but we just want to involve it. So now we are analyzing and making an analysis of this area. By in 2014, we will finish our analysis. Then we will make some large-scale products on this, and if it turns out to have positive business cases, then we will use the solutions. So we do have some agreement about specific objectives here. We have agreed with municipalities that by end 2014, all pupils shall have secure access to wireless internet, secure and stable. By end 2014, all pupils. And we have made another specific objective agreement with municipalities in 2015. All examinations shall be carried out digital. I don't know if you have seen examinations, but you use terrible papers. It's sent to censors, it's sent to teachers, and they have a big meeting when they send you a pile of documents in front of them. Now we want digital solutions. It's much more effective. We reduce the use of resources, and the quality will at least be just as good as it was before. Yes. Then I would say, how can we do this? Why is it that we in Denmark can do this right now? It is because of this I showed you before. I just used 1 minute, because that is the reason why I can do it. Where is it? It's coming up now. Tight budget. I've been in Norway, talking in Norway about welfare technology. They cannot persuade their local municipalities to work with this. Not really. Why do they do that in my country? It is because they know this is the only way they can cope with the challenges we have. Because they will not have any more increase in their budgets. They will only have any massive. The last 3 years, and 4 years, the politicians in Denmark, local politicians, regional politicians know they had to work with this technology, they had to improve efficiency. And when we can document that at the same time improve profits of the users, then of course they have no chance, they have to do it and they will do it. For about 4 or 5 years ago, we couldn't persuade them to do it. We had good business cases for some of our projects in our foundation, and it was very difficult to persuade communities to use these business cases and to implement it. Now, they have given us a strong political mandate to work with this, and this goes for communities, from municipalities, as well as for regions and the state. So because of this, because of that we have problems, I think we will solve the problems with the welfare technology, IT and ICT solutions. And I promised you a few words about what is, as we see it, welfare technology. As I say it, it's a user-oriented technology. It has a purpose in my country. It has focus on more quality for the users and more efficient production. These two are the main objectives. It can be many things. It can be software platforms that can work with technical aid equipment, and it can be what I showed you before, many of these solutions. All these solutions I showed you are all called welfare technology solutions. But they are all user-oriented. They all demand that users actively participate in solving their own problems. And as I say, that is a very good solution. Now, I think this is about what I would like to tell you. But as you can hear, this is a never-ending story. We have to continue because technology is all the time developing. Next year we might work with some other kind of technologies. And the only thing we have to secure is that the technology we're working with now can be used when we go to other kinds of technologies. So this is a story that never stops. We have to work with this all the time. But I'm quite sure that we will get much more effective public sector, which is necessary, and we will get much more quality for the end users, which is the main target of this. Well, I hope you could understand some of it. Thank you for this.
So I understand the questions are louder. It's allowed for that. Because I understand you need to read, yes? So
Two very, I think, general and important things. First of all, of course, the benefits are very evident and no any doubt. And of course, we think about ourselves, how we could try to follow this way. Of course, first thing is education of our elderly sector of our society. This is the problem. I can't imagine that in your case there was no any problem with digitalization of that. But I don't need to answer. Two questions. What kind of role have been playing universities implementation this system? One thing and another thing, what would be your advice? Our one of painful issues, always discussion public and private sector cooperation. And especially in our case, when left-wing parties, they ignore private sector in power. When right-wing parties in power, the discussion goes on. So what would be the advice? What we should do to change the mentality of cooperation, private and public?
Try to answer some of this. Now, concerning the elderly sector, I can give you an answer actually. What does the elderly group say to using technology? Yes, up to about 80% of those elderly group do actually accept new ways of working. And many of these projects that we have supported, it's targeted to elderly people. Then we have people calling us and saying, can we participate in this project? Because we would like to use this technology. That's about 20% moving up. This is because we always say 80% is okay. Now, the 20% we have to use the old-fashioned way. We have to do it. They all have to have this. But it seems as they are rather satisfied with new solutions and they like to work. And this is today, I mean, the children that we know today are growing up with it. They are born with this technology. One day. Now, what about universities? We use them in this way that, as I mentioned, when we try to cover a problem, we take the public providers must find the problems that they want to solve. Then they involve private partners, private enterprises, private universities, and universities as well. And they work together to find the solution. And they have active universities in South America for these solutions. They are using that technology. So they are involved. And some of the solutions I showed you, the big solutions are legal solutions. They have universities to evaluate these problems because they're big. So we are using universities for this. So universities
are involved in this development. What about the private and public partners? You can't do this without cooperation between public partners and private partners. It's impossible to do it because public partners, of course, cannot solve the problem. They don't know much about welfare technology. The private partner does, but the private partner might not know so much about the public sector's problems. So we have enterprises who are having their employees working in communities and municipalities for a time, so they can have some experience about what are the problems. Then they go home to the company and try to develop solutions. That is the good way they are working together. In all the project we have given support for the only public sector project we support. On average, two private parties in all the projects. So this is why we said, if we work more systematically, we will do that now. We can set objectives and by 2020 we'll implement this in the solution. Then we give a clear signal to the private enterprises that there's a market for this. By 2020 we will want to use the solution. They have possibilities for developing solutions and they know they have a market. And another thing they know is that we get a business case. And this business case, we know the use of the international market. When they go out there and they say, this is the solution to Denmark, and we show the success list. We don't know if you get the same results in the country, but we can tell you that this is what we know we can get efficient gains and quantitative uses. And it has turned out to be a good thing for these private companies. They have actually expanded the market by using our business cases. So this you can only do in close cooperation with partners.
Thank you very much. Thank you. Before giving the word to the two commentators, maybe from my side a little bit of a small remark. We all know company Google, yes? And I think Google CEO, he said golden words some 3-4 years ago. He said mobile first. I mean, this was a message that it's a fundamental change going on in the whole world. Then, right after that, I think a couple of years ago, they made a golden statement as well. They said that there's an additional one more human right, your right to internet. And I think they put this black and white more like a constitution. That was also a signal that the internet actually is both tool and also the ability to do things faster, maybe even more convenient and of course cheaper. Right now, when I listen to the Danish example, they're saying digital by default. And again, it's a very, very strong saying. Everything what you do, it should be by default digital. And then, looking at all this, I was asking myself the question, so who could be first? Engineers or politicians or ministers or universities? And then I remember, let's take the Lithuanian example. Some 3 years ago, I think EU was already stating that Lithuania has probably one of the best digital infrastructure in the whole European Union.
And fastest.
And fastest, yes. So there's two things, coverage and speed, yes. And then the business people were advising, let's make a very simple statement, digital to every home. But that has never happened. Why? Because it's so damn difficult to agree between the politicians. Behind, of course, is money. Where do we distribute money? There is always will be, an urgent issues to distribute money one direction, or another direction, or third direction. But as soon as you do it, you lose the direction. So, by giving such a pretty wide comment from my side, and of course I do believe that there will be a lot of comments and questions from your side, I'm going to give now the comment to Mr. Dennis Sonnegaard, a project manager for World Technologijos. So, please. You can limit like 10 minutes, that will be fine.
Do you want me to do it from here, or?
It's up to you.
I'll just keep seated and keep it informal. So obviously it's easy being a commentator after such a thorough presentation. And actually my comments will be primarily based not on my current position as project manager for the Baltic region, but from my time.
Denise,
Yes.
you want to start here, what would you like